Hi, I'm Dr. Kim Sage. I'm a licensed clinical psychologist in Newport Beach, California, and I help kids and adults heal and thrive through a range of mental health challenges. This channel is all about mental health and helping you know, heal, and love yourself more. Today's video is all about men and depression and what you need to know, because did you know that men's depression doesn't often look like women's depression? And as a result, men often get missed in their diagnosis entirely. They often don't get treated, and because women tend to attempt suicide more often, but men tend to complete suicide attempts more often, it truly can be fatal for you to not know the signs and symptoms of depression in men. So at the end of this video, you'll know what those look like, and you'll know the most common ones, the most hidden, most frequent ones. And so if you or someone you love is a man who is struggling with depression, this video is for you. So the big issue is, why do we often miss diagnoses in men's depression? There are several factors. One of them is that women tend to go to the doctor more often. So we tend to see our OBGYNs, our primary care doctors, and because women tend to present with more classic symptoms of depression, our symptoms are often more recognized, treated, and seen. Now, men tend to do a couple of things differently. They tend to have different types of coping skills. They tend to, not all men, but often deny their feelings and deny their depression and want to push it down because it doesn't feel safe, or they're not really sure what's going on. And men aren't really socialized. I think we're changing that, but historically speaking, men have not been socialized to talk about their feelings, and especially their negative, more depressive type symptoms. Men often will find ways to deal with their depression in ways that we often don't think of as typically depressive. And so I'm going to go into that in just a minute. So we really just have a failure to recognize symptoms, a tendency to deny those symptoms. The last one is that men's symptoms can often present in very physical ways. And I'm going to get into that in a minute. But because the symptoms can present often hidden in things like headaches, back pain, digestion issues, sexual dysfunction, these are some more reasons why we often miss it in men. Many men have also learned to focus on self-control and emphasize self-control. And so they often feel they have some power to change and to sort of manipulate the depression in a way that will make it go away. But that doesn't always work. And so it's this cluster of differences about men's depression that can make it really difficult to understand and see, and really important not to miss the signs and symptoms. Okay, so let's start with the major symptoms of depression that men present with more than women. But before I do, let me just say this. Men do tend to have the typical clusters of depression, things like, hopelessness, tiredness, exhaustion, fatigue, lack of pleasure, lack of motivation, insomnia, food or weight issues. Those typical clusters I'll link down below, men do often have, but in addition, they also present with these next few symptoms that you don't want to miss. So I'm going to get started with the most common symptoms of male depression. And when I get done with those, you will know the major ones to look for. And we're also going to discuss some triggers so that you can also check around and see what else is going on and put some pieces together with regard to depression about your partner or someone you love as a man at the end of this video. Okay, so the first one, as I said before, men often have physical symptoms, and they will often be things like back pain, headaches, digestion issues, sexual dysfunction. There can be a cluster of physical symptoms that don't necessarily have a linear connection to in terms of the medical issue, but men will often complain in a very physical way, and the depression will often present itself in a physical way in their bodies. The next one we often see that is very common in men and not so common in women is anger, irritability, just a general moodiness and crankiness, above and beyond whatever your man's typical irritability might be, or if at all. And so men will often present with even sometimes violent and controlling and raging behavior, and especially if you're seeing an irritability and a crankiness and even a rage, like I said, that are not typical for your partner or the person that you love, that could definitely be a sign. You might even see the fact that they're losing their sense of humor. They're expressing more road rage. They have less patience with you or the kids, or they're really pissed at their boss all of the time. So they're upset at work. And it seems to be their reactions are much more irritable than they used to be. The The next one that men often do that you don't see in women so much is reckless behavior. So gambling, extreme substance use, which I'll come back to in a minute, risk-taking behaviors, driving too fast, a lot of just sort of living on the edge and taking unnecessary risks. That can be a component of male depression. The next one, as I said, is substance use or dependence. So a lot of alcohol, drinking, partying, drinking too much, sitting in quiet maybe and drinking and using substances, just engaging and even in partying in a way that you really haven't seen before. So definitely an increase in substance use can be one of the more classic signs. The next one that men often do is what we call escapist behavior. So a lot of isolating, getting into sports alone, working too much, sort of removing themselves from you and really finding themselves deeply entrenched in either like watching TV for hours alone, doing things like watching sports for hours. And these are above and beyond the typical, right? So this would also be a shift in what you normally know to see in your partner or a man that you love. They often will withdraw from family and friends. They're too tired. They don't want to go do things with you and the kids they used to, or you as a partner, or you and your friends. They tend to just be, generally speaking, removing themselves from life in some way and isolating. The next one that we can see with men is sexual dysfunction. Now, if you're taking antidepressants, obviously that can interfere with sexual functioning, but men often will have a cluster of sexual dysfunction symptoms that they're just way too embarrassed to tell anyone about. And so we can see things like erectile dysfunction, impotence, lack of interest or motivation in sex. And all of these would also be shifts and changes from behaviors and ways they had engaged with you sexually or with themselves in the past. And because they're often reluctant to share these symptoms, there can often be a shame or isolation or embarrassment that comes along with these type of symptoms that men don't necessarily know what to do with. And so that often leaves them more isolated and feeling more a sense of failure or a lack of ability to perform that can contribute to an already underlying feeling of depression and make things even worse. Additionally, men often present with symptoms that have an anxious component to them. So you'll see increased anxiety, increased worrying, and that often, like I said, kind of clusters under the irritability, but that is often one you will see. And we know that anxiety and depression are often very closely linked together. And so this type of worrying or stressed out, chronic stress behavior can also be a part of it. The other one is work or career issues. I think that when men are presenting, whether they're not performing at work so well, they're not meeting deadlines, they're not engaged with work, they seem disconnected from work, you might begin to see a change and shift around work and work dynamics and how a man feels and talks and expresses himself about how he feels about work, his boss, the environment, and his frustrations with work in general. You might often see that increasing if a man is depressed as well. So those are the main symptoms in addition to the typical symptoms of depression. Men often just don't get the kind of self-care and questioning about how they're doing and feeling like women do. And the truth is, guys and women, men need self-care and hobbies and love and support and emotional connection just like we do. It's such a misnomer to think that men have less feelings and aren't as engaged and don't care as much. Just like women, every man has a spectrum of his normal behavior, his normal emotional range. And so while we're all different, we're not that much different. We can still be extremely depressed and be trying to hide it. I think in male culture specifically, oftentimes men are taught to suppress and hide and like work through it and don't show it. But when it gets to be significant, these type of behaviors and clusters like anger, irritability, substance use, etc., they're going to push their way through because no one can mask true clinical depression. It really is a difficult thing to deal with, and it makes us desperate to want to find ways to survive and cope. And so I just think for men, the way they cope often looks a little different. And as I said before, they don't really present the same way. So that makes it especially difficult. Okay, so the last part of this is we just discussed what the common symptoms are for depression in men. Do you know what the common triggers are that tend to help ignite depression? Now, let me just say this. We know that depression has a genetic component. If you have a family history, you're more likely. There's an environmental and sort of circumstance and life-based issue. There can be childhood and trauma-based triggers. Obviously, you can have medical issues which can ignite or contribute to depression. So outside of those, some additional ones that can cause depression to sort of begin to grow for men are often things around work or career difficulties, ineffectively dealing with stress excessive use of substances like alcohol, marijuana, medications that are not prescribed, just an increased substance use in general, early childhood loss or trauma in general. We often don't talk about men and men's trauma, and I'll discuss that more in the next video around men's therapy topics. And dealing with chronic stress and life's daily difficulties. Men often, I don't think, are given the same push towards self-care and self-regulation by taking good care of themselves. And so we'll discuss that more too in the next video. But a lack of that can really also contribute and be the kindling, this combination for men's depression. Now, let me just say once again, men do tend to succeed more often than women when they do attempt suicide. It's a very serious issue. Obviously, if a man is expressing suicidal thoughts, those would fall under your classic symptoms, but the ones I discussed today don't necessarily do that. I do want to say, as somebody who has loved and lost a man with depression in this world, it has often been going on for many, many years, and many men themselves often neglect treatment, the signs, and getting the support that they need. I know that's changing, but I still think we can do a whole lot better. And so please know, if you are considering not being here anymore, that you are loved and cared about, and that there are many, many resources I will also link down below to help you. Please know that you are not alone, and you deserve the love and support and help that you truly do need. All right, so thank you so much for listening. Have a good rest of the day, and I'll see you next time. Don't forget, the next video is all about men's depression and therapy topics, and some ways to help men and some ways to support men if they are struggling with depression. All right, thank you so much. I'll see you next time. Bye-bye.